Good evening, everyone. So sorry for the late communication as far as trying to log on, was having technical difficulty. So I want you all to know, especially for my new students, today is the beginning of the new module. We're in module 154. So I'm going to share my screen so you all can see what it actually looks like and what you're supposed to be doing. So I'm going to share my screen now. So can you all see this gray section over here? So the gray section, when you all log into your module, either it's 154.14 or 154.16, the first thing when you click on is going to be the welcome. So the welcome here is showing the class expectations, tips for success. Please read through this. It tells you when this module starts, which is today, module 154. It shows the book that we're in, step-by-step medical coding, and you also have your workbook. The workbook says at the top is going to say workbook, and the textbook is going to say textbook, the step-by-step medical coding. This module 154, using coding in relations to patient surgery and the body systems. August 31st, this module ends on October 26th. This is a 40-day module. This is one of our longer modules. And so right here, this is where you would find this. You would find this in the welcome, in the gray section of e-learning. Next, this is the roster. This is where all of your classmates are located. So if you need to find out information or when you meet, one of your classmates, this is where you can click on to get their email address and you can email your classmates. That's the roster. Next, we have news and announcements. This is what you should check daily, your news and announcements. So I put in news and announcements, Zoom class today, 4 p.m. Chapter should be chapter 12 and the link below. So here was the link for this Zoom class. And I just had on here Zoom. Also in news and announcements, I put in here, I post this all the time, this was welcome to day 1 of chapter 12, Anesthesia. Today, we start chapter 12, the new module. Everyone should be logged into 154, not 153. We're no longer in 153. If you still are working on assignments, that is fine. You can go back in 153 and complete your assignments and upload them. Other than that, today is a start, brand new start, Thursday, day 1 in chapter 12, Anesthesia. So everything that you would need to know, I always post in news and announcements. Next, we go, here's your coursework. So let me switch to the student's view. So this is what it will look like when you all are looking at it. Your coursework, day 1 of 40, which starts today, chapter 12, due today, 11:55 p.m. Your daily assignments, here is your daily assignment, day 1 of 40. And it has on here. So remember, you do not have to do your objectives that's here. Only thing that you're going to submit to me is what's in red and where it says submit. So it has read chapter 12, pages 337 to 346. This will cover your objectives 1 through 3. Complete and submit chapter exercise 12.1. Define anesthesia and define the different types of anesthesia. Submit. And then I had on there, please watch the video below. So this, everything in red and wherever it says submit is what you're to submit. Do not go through and say you think you have to submit all of these. No, whatever is in red, I would always have submit by. That's what you would need to submit. And then on here, when you go down to your labs, it shows you your labs of what you would have to do. Remember, you have 7 days to complete your labs. By us just starting this this module, your labs are due by Sunday because today is Thursday. So you always submit your labs by Sunday, 11:55 p.m. We are closed Monday in observation of Labor Day, and I will have that posted. We do not have class on Monday. So it should be no excuse for nobody to be late on submitting daily assignments or labs. And on here, you would have on here, it say at the bottom, submit. And then what is an anesthesiologist? Submit. This is your lab assignment. You have until Sunday to complete your labs. But remember, best practice is to do your daily assignment and your lab on the same day, because then on Friday, you don't have to worry about submitting anything. You're done by the end of the week. But I do understand a lot of times people don't have time. We have families, we have jobs, we have all other things that's going on. So just remember, though, you do have until Sunday to complete your labs. Then you have on there your day 2 of 40. So everything that you would have to submit is always in red. So this is your coursework, and this is how it will look in your view. So for my view, this is what it looks like when I look at it. So I only have one assignment that was submitted so far for day 1 of 40. And it shows me here, status 1 of 18 complete. So remember, if you're not able to upload your assignment, post your assignment in comments. If you're able to upload it, please do not email it to me. I have over like hundreds of emails. So if you're able to upload it, do not email it to me as well if you're uploading it. If you post it in comments, do not email me the assignment. If it's in comments or if you upload it, I already have it in the section. You do not have to email it to me as well. So it has on here for your day 1 of 40. I have so far, one person has submitted an assignment. Remember, it's due by 11:55 p.m. tonight. And as far as labs, I have somebody submitted day 1 and day 2 labs, which is great. But remember, you have until Sunday to submit your labs. Your syllabus for this module. You will click on syllabus in the gray section of e-learning. This is your syllabus. This is everything that we will cover in this module. We're in lesson 1 right now. The 3 objectives that we're covering: define types of anesthesia, explain the format of the anesthesia section and subsections, and understand the anesthesia formula. These are the 3 objectives that we are covering for today and tomorrow. These are the ones you will be covering. So that's under syllabus.
Right.
Then you have gradebook. I can't click on gradebook because everybody's grades are here, but this is where you would check your grades under gradebook. Attendance. This is where you would check your attendance to know if you were absent or if you were marked absent by accident or whatever. This is where you would check attendance.
Be a drip in here, Corey.
Okay, PowerPoint. Please put yourself on mute. PowerPoint slides. This is where you will find all of your PowerPoint slides for this module. Chapter 12, you would click on your Chapter 12 PowerPoint slides. I have them at the bottom because we're going to go through some of them along with the book. Course information. This is Miss Jessica Washington, who is our Director of Education, and this is Miss April Harrison, Miss April Austin, who's the online director. And this is myself here if you ever need my email information, which I always post when I send you correspondence. So now we're going to go to Chapter 12. Again, today is the first day of Chapter 12, Anesthesia. So it says right here, so this is important information to read. Not many coders will report anesthesia services as it is very specialized. However, it is an excellent career option. Just like evaluation and management, the anesthesia codes are assigned using distinctive principles. So not many people are going to report anesthesia service. Like I said, it's a specialized service. So the chapter topics and our learning objectives are the first 3: define types of anesthesia, explain the format of anesthesia section and subsection, and understand the anesthesia formula. So this is one of your questions that you all, in one of your assignments, types of anesthesia. The anesthesia section is a specialized section that is used by an anesthesiologist, anesthesiast, or other physicians to report the provision of anesthesia services, usually during surgery. Anesthesia means induction or administration of a drug to obtain partial or complete loss of sensation. Analgesia, absence of pain, is achieved so that a patient may have surgery or a procedure performed without pain. Types of anesthesia may be general, regional, local, or monitored anesthesia care. MAC, moderate conscious sedation, is not reported with anesthesia codes, but rather is reported with medicine codes. So this is one of your questions as well. Name the different types of anesthesia. Types of anesthesia, that was one of your objectives, may be general, regional, local, or monitored anesthesia care. So it's always important when you're reading to look at your objectives that you're covering. So that first objective said, define types of anesthesia. As you're reading, you see the types of anesthesia, and it tells you types of anesthesia: general, regional, local, or monitored anesthesia care. Then it tells you MAC, which is the abbreviation, moderate conscious sedation, is not reported with anesthesia codes, but rather is reported with Medicare codes, medicine codes, sorry. Local anesthesia is usually administered by the surgeon. The practice of anesthesiology is not limited to administration of anesthesia for surgical patient. The American Society of Anesthesiologists, which is ASA, defines the practice of anesthesiology as dealing with but not limited to the following: the management of procedures for rendering a patient insensible to pain and emotional stress during surgical, obstetrical, and other diagnostic or therapeutic procedures, the evaluation and management of essential psychologic functions under the stress of anesthetic and surgical manipulations, the clinical management of the patient, the evaluation and management of acute or chronic pain, the management of problems in cardiac and respiratory resuscitation, the application of specific methods of respiratory therapy, the clinical management of various fluids, electrolyte, and metabolic disturbances. So I'm gonna look and I'm gonna bring you to the PowerPoint slide. So if you're having difficulty with understanding some of what they're saying and you need a summary, check and look at your PowerPoint slides. So it tells you, it gives you the definition of an anesthesiologist. It's a doctor of medicine specialized in anesthesia. And it tells you, usually independent practices, not hospital employees. So an anesthesiologist is a specialized, certified specialist. They're usually not just in the hospitals. They'll come in, like they say, well, I have to get the anesthesiologist to administer, anesthesia. So it tells you, not in hospital employees, usually independent practices. Example, Anesthesia Associates Incorporated or pain clinics. Services are reported separately. And I want you all to remember, when you look at your PowerPoint slides, always remember to look at the bottom because it goes into and explains more in depth. This great section at the bottom, it says, the anesthesiologist is a physician whose medical specialty is anesthesia. These specialties are often members of outside practices who report their services separately. And then they give you a question and answer it. Why would the anesthesiologist services be reported separately? And it tells you, because it is a separate physician who specializes in this type of medicine. So always read the bottom captions under each slide. Here it states uses of anesthesia. So the uses of anesthesia, people use anesthesia to relieve pain, to manage unconscious patients, life functions, and resuscitation. Here, use of anesthesia creates a state of analgesia, the absence of pain, that allows the patient to have surgery or another procedure performed without experiencing pain. The anesthesiologist's job is to administer medication that will induce general, regional, local, or conscious sedation in the patient while managing the life functions of the unconscious patient and directing respiratory or cardiac resuscitation efforts. If a patient suffers cardiac arrest while on the operating table, Why is the anesthesiologist the one to manage the problem associated with resuscitation? And it gives you the answer to that question. He or she is responsible for management of the pain while under anesthesia. So you see why this is a special person. You have to be specialized training, because once you go under anesthesia, you have to make sure that that person knows, that anesthesiologist knows what's going on. Because some people, hate to say, go under anesthesia and they don't come from it. So they have to know the monitor and how much, when to relieve, what to look for. So that's a very specialized training. Methods of anesthesia. So all of this information is also in your textbook, but the PowerPoint slides breaks it down so that you really get a full understanding of what it's saying. Methods of anesthesia. This is endotrachea. Endotrachea, and it's showing you a diagram through the mouth. They're putting that tube through the mouth, and it tells you what is anesthesia: administration of a drug to obtain loss of sensation. And it tells you different types. We already know the different types: general, regional, local, or monitored anesthesia care. So that's definitely going to be one of your test questions. What are the different types of anesthesia? So you might want to highlight that or mark that down. The figure shows one method of delivering general anesthesia. Endotracheal anesthesia is accomplished by inserting a tube into the nose or mouth and delivering a gaseous drug through the tube. Methods of anesthesia, 2 of 3. Local, application to area. So it's local, is an injection or topical. With local anesthesia, an anesthetic agent such as lidocaine is directly applied to the area involved as a topical anesthesia, or is administered by local infiltration through a subcutaneous injection, as shown in figure 12.2. So they're showing you how that's administered. And it says, what types of procedures would use local anesthesia? Relatively minor procedures such as tooth extraction or suturing a wound would be candidates. And they have, what is a key difference between local and general anesthesia? There is no loss of consciousness with local anesthesia, and there is when a general is administered. So these are questions that will be on your test and exam and in your questions that when you're going through your book. So make sure that you're reading through these PowerPoint slides. Methods of anesthesia continue. Epidural, into epidural space. Regional, field or nerve, includes spinal and epidural. When is an epidural anesthesia used? To numb certain parts of the body. When would you expect epidural anesthesia to be used? When operations on the leg or pelvic region, and is commonly used during childbirth. Regional anesthesia involves blocking the nerve supply to a part of the body in order to eliminate pain. It is produced by a field block forming a wall of anesthesia around the site by means of local injections or nerve block injections of the nerves close to the site. So you see how the difference is, and if we go back to the book, how it breaks down all of this so that you can better understand what is going on. So we have the spinal, we have general, and we have regional. So those were the PowerPoint slides for those, for you to be able to understand more in detail and showing diagrams of what it looks like. So it says, although not a type of anesthesia, a procedure used by anesthesiologists for treatment of a post-dural puncture headache is a blood patch, also known as an epidural blood patch, EBP. Epidural blood patch. A blood patch procedure is when a cerebrospinal fluid leak is closed by means of an injection of the patient's blood into the epidural space at or near the area of the dural puncture that was accessed during spinal anesthesia. Blood patch procedure is performed with epidural or spinal anesthesia. Then you have your patient controlled analgesia. PCA is a system that allows the patient to administer an analgesic drug such as morphine to control pain. A device is attached to a pump holding the drug, and the patient can depress a handheld button to administer a dose of the drug. So this is what we're going to cover right now. And then that question for you, which you have, so make sure you read through this, read through your PowerPoint slides. And that first question for your quick check, which is on one of your assignments, says, in the index of the CPT, you would reference this main term as these two subterms to locate a blood patch code. What would be the terms that the subterms you would look under for a blood patch code? And we just read through it. So that is your question for the night. So make sure you all read that information so you would know it. We just read through it and it asks, that's one of your daily assignments. In the index of the CPT, you would reference this main term and these two subterms to locate a blood patch code. Does anyone know those answers right now? We just went through it. So make sure that you read that section, read your PowerPoint slides to get that information for that answer. And we went through this when it says placement of an endotracheal tube for administration of anesthesia. So make sure that you read and look through those diagrams. We went through all of this. Moderate conscious sedation that can be provided by a surgeon or the surgeon's staff while the surgeon is performing a procedure. It provides a decreased level of consciousness that does not put the patient completely to sleep. So that's moderate sedation. So make sure you always read your coding shots. Moderate conscious sedation codes are only reported when the physician performing the procedure administers the sedation and an independent trained observer assists. This is very important to know. Moderate conscious sedation codes are only reported when the physician performing the procedure administers the sedation and an independent trained observer assists. Moderate or conscious sedation methods are much less invasive than anesthesia services that provide the complete loss of consciousness. So when we go back up to our objectives, we have gone through, define the types of anesthesia, explain the format of the anesthesia section and subsections, understand the anesthesia formula. So we've gone through those three objectives, which is also located in your PowerPoint slides. So we went through that part, and also I just want to say the different sections. So caution, make sure you always read what's caution. When you have the hand up and the red and it says caution, it tells you, do not confuse conscious sedation with monitored anesthesia care. Conscious sedation is administered by the surgeon or another physician. MAC is provided by an anesthesiologist or CRNA. So make sure you never confuse the two. Then we have the anesthesia section format. Most anesthesia codes are divided first by anatomic site and then by specific type of procedure. That was that next objective. The format. Most anesthesia codes are divided first by the anatomic site and then by specific type of procedure. Anatomic divisions, and it's showing you here. The last four subsections in anesthesia, radiologic procedures, they give you the code range 01916 through 01942. Burn excisions or debridement, they give you that code section. Obstetric, they give you the code section, and other procedures are not organized by anatomic division. So these four sections, the last four sections in anesthesia, are not organized by anatomic division. The CPT codes in the radiology procedures subsection report anesthesia services when radiologic services are provided to the patient for diagnostic or therapeutic reasons. And they're giving you examples. Therapeutic reasons. Anesthesia for therapeutic interventional radiologic procedures involving the arterial systems, carotid and coronary. So once you read your PowerPoint slides, this would break down more for you. So it's telling you it's giving you examples. They tell you anesthesia providers may be, and so they're telling you who they may be, anesthesia providers. Then 12.1, anesthesia format. Which subsections are not divided by anatomic site? Anybody can tell me that? We just read through that. Which subsections are not divided by anatomic site?
The 1990 through the 1999 sections.
So zero, say that again.
It's the other procedures, 1990 through 1999 are not organized by anatomic division.
Right, so it starts here. The last four subsections in anesthesia, so it starts from here. Radiologic procedures, so 01916, burn excisions or debridement, obstetric and other procedures. So it starts from radiologic procedures, 01916, all the way to 01999 are not organized by anatomic divisions. So you already have that answer for your next exercise. Then here, for that next exercise, you have that answer. Then here it tells you with exercise 12.1, which subsections are not divided. So you have that answer. Then it states, what is analgesia? We have that. What is anesthesia? We went through that. Name 3 types of anesthesia. We went through that. And what is the type of sedation that enables the patient to maintain breathing for himself or herself? Can anybody give me that answer? What is the type of sedation that enables the patient to maintain breathing for himself or herself? I just read through that.
Is that the endotracheal?
No, that would be moderate sedation. See right here, moderate sedation. They're conscious. Moderate or conscious sedation is a type of sedation that can be provided by a surgeon or the surgeon staff. Excuse me. While the surgeon is performing a procedure, it provides a decreased level of consciousness that does not put the patient completely to sleep. So you have that answer. So we're going to stop right there. We have covered those 3 objectives. And remember, this is the first day of the new module. So everyone should be in module 154, as well as 153 if you haven't completed your labs or if you haven't completed your exam. If you need that exam, the exam is open until Sunday. So you have until Sunday to complete that exam. If you need your daily assignments reopened, please contact me. I will not just reopen them. You would have to communicate. Send a text message to me or an email saying you need more time, you need that daily assignment reopened. So do I have any questions or concerns with e-learning, navigating through e-learning, getting into e-learning? This is your time to ask now. Any questions or concerns? Does everyone on here understand how to navigate through e-learning?
I got it.
Okay. So if we don't have any questions, remember today, please submit your assignment. So far, I only have one assignment for daily assignment. I know it's open until 11:55 p.m., but let's get on it. I mean, this is day one. Nobody don't want to do their work. Get that daily assignment, and I've given you the answers for it already. So let's get it. Let's get in and get that done. Remember, if you have the opportunity and time, try to complete that lab. Try to get that done because we have a holiday Monday. So if you do everything by Friday, you're done. So you won't have anything to do Saturday, Sunday, or Monday until we come back on Tuesday. So take advantage of that extra time and try to complete everything on Friday. Like I said, I do understand we have families, we have jobs. I'm only stating this for those who do have that opportunity to get everything complete at the time, you know, just so you can have that extra time for yourself and your family. Try to get everything done by Friday. We have a 3-day weekend that I'm definitely looking forward to. So if anybody, you know, if you feel free to contact me, email me if you still have any questions. On Friday, you know, my office hours are till 4 p.m. I am off on weekends. I do not respond to texts or emails over the weekend. I will respond if you do text me over the weekend. I will not respond until we come back, which will be on Tuesday. So please try to get in contact with me if you have any questions or concerns by Friday, 4 p.m. Thank you all. This will be recorded. I will be sending you the link later on this evening. Enjoy your day. Enjoy your evening. Have a safe holiday break. And remember to stay in contact if you have any concerns. Bye-bye.
Bye.